Why don't we start off by you could introduce yourself, your name, and where you're currently working, and what your title is, please.
Great. Thank you. Thank you so much for giving me the opportunity to be interviewed by you there, Dr. Steen. My name is Javier Romero. I am a general surgeon, trauma surgeon, and also a critical care intensivist in Ventura County. I've been practicing in this area for approximately 22 years. I'm currently the program director for the Community Memorial Health System Surgical Residency Program, and I'm the chairman of the Department of Surgery at Ventura County Medical Center.
Great. Can you tell me a little bit about what your life was like growing up, please?
Yeah, I grew up in the East LA, Pomona, Ontario area since I was 13. Prior to that, I lived in New York. And my life has been around a lot of car cultures with hot rods and lowriders. My brother and I owned a body shop for many years. He still owns a body shop, and I still participate in a lot of car shows and customized cars.
Nice. Yeah, we'll have to put a picture of one of your cars in here.
Yeah, I can show you some pictures.
How did you find your way into becoming a surgeon?
Well, I started off my medical school career, started off in University of California, Davis. Prior to that, I went to UCLA and UC Irvine as an undergraduate in biological science degree, and I was heading towards a PhD in science and neuroscience. I decided to be a surgeon as a third year when I helped a general surgeon with an ectopic pregnancy in a very rural community in Northern California. At that point, I decided that surgery was for me. I was very much used to working with my hands because prior to medical school, I was working in the body shop as well as a part-time mechanic prior to training.
Nice. What do you do with your free time these days?
I still participate in the car culture with custom cars. I started surfing when I moved to the Ventura County area. Well, first I learned how to swim, and then I started surfing. And I still participate in the surf culture here in this county and in this city as well. It's very much embedded in the surf culture, and I embrace it as well. I do a lot of stuff with my family, and my middle daughter and I are building a hot rod truck currently. As a matter of fact, we were working on it today.
Very nice. What's your favorite part about working with residents?
Yeah, it's the aha moments, and it's really hard to explain the aha moments with a lot of them. But it's when the light bulb turns on, and they either get a pathophysiology, or they get a certain technique, or they lay out the operative field in such a way that they make the operation very smooth, efficient, safe, and pleasurable for everybody around them. Those are the moments that I really enjoy, and I also enjoy their joy when they see that they're progressing very, very nicely. One of my favorite times of year is graduation because I see them actually grow up. They become they come in as medical students, very scared of the operating room, but with the confidence. And then when they graduate, they have not only the confidence, the competency, and also that love of the craft of science, and more importantly, the craft of surgery.
Yeah, definitely. Along those lines, do you have one piece of advice you'd give to an incoming intern into a surgical residency?
Yeah, and the advice that I give a lot of the folks is that it's a 5-year program for a reason, and it's okay to have help. Think of surgery now as a team sport. You can't do it by yourself, and bring that type of esprit de corps and philosophy into team building. And they say that the surgeons are usually the leaders in the operating room and in the traumas and stuff. And I agree with that, but also recognize that it's always going to be a team type of activity, and incorporate all your players within your scope of practice. And as an intern, ask for help. And it's okay to ask for help right off the bat. It makes your life easier. It's a lot safer. And it also brings in other ideas and philosophies in your practice. So ask for help is really what I tell the interns. It's a team sport.
Yep. Yeah. If you knew how to do it right away, you would not need to be a resident.
It's exactly right.
Well, thank you so much for your time.
I
And we
appreciate
look
you. I
forward to
appreciate your time. Thank you so much.
seeing you out there, out and about.
All righty. Take care.
Take care.